All right, guys. Hi, my name is Denise Machicado, and I will be going over Chapter 8, Mental Disorders. So I want to start off with um, just going over some myths and realities. So the first myth of mental disorders is that in general, the mentally ill are extremely weird or greatly disturbed. But in reality, most mental patients are far from greatly disturbed, even among schizophrenics, which are the most severely mentally ill. The flamboyant symptoms of hallucinations and delusions are not the most important characteristics of their disorder. Another myth is that the mentally ill are mostly crazed, violent, and therefore dangerous. But in reality, the great majority, about 90%, are mental patients of patients are not prone to violence or criminality. They're most likely to hurt themselves than to hurt others. Another myth is that older people are more likely than young people to suffer from depression. And in reality, this is not true. Over the past few years, the problem of depression has increased so much among young people that today they're more likely than older people to suffer from depression. And the last myth is that in the United States today, mentally ill criminals are more likely to be sent to a mental institution than to a prison. But in reality, they're more likely to be sent to a prison. Okay, so I'm going to talk about the types of mental disorder. I'm going to be focusing on two, which is organic disorder and functional disorder. So organic disorder is caused by damage to the brain, which in turn may have originated from a tumor, head injury, viral meningitis, brain syphilis, lead poisoning, deterioration from old age, drug abuse, and or acute physical damage. And then functional disorder is believed to result from psychological and social factors such as unpleasant childhood experiences, impersonal conflict, or social stress. The functional disorders are actually a much larger category of mental disorders than organic disorders. Psychiatrists, psychologists, and sociologists are more interested in the functional disorders as opposed to organic disorders. So in the branch of functional disorder, I'm going to be talking about psychosis, neurosis, and personal disorder. Excuse me. Psychosis is losing touch with reality. So the patient cannot attend school, work, or do other things like normal people. An example of psychosis would be schizophrenia. They think and talk unconventionally, illogically, or in ambiguous ways. They have hallucinations, hearing voices where there's only silence and seeing things that does not exist. They will talk to themselves and scream loudly to voices only they can hear. Another example of psychosis could be manic depressive disorder or bipolar disorder. So what is bipolar disorder? It's basically like two opposite extreme moods. So on the one hand, you can have mania, which is having a lot of elation, confidence, excitement. You're joking, you're laughing. You're not very happy, but you're in like a better, more energized mood. And then the other side would be like depression, where the victim feels overwhelming despair, experience the delusion of worthlessness, and thinking of even committing suicide. They lose the desire to talk, move, eat, or sleep, and they spend a lot of time crying. The last type of, or second type of functional disorder is neurosis, which is typified as an inability to face reality. So an example of this would be an anxiety reaction, obsession and compulsion, which involves some bothersome ideas that keeps interrupting the individual's train of thought. Another one would be depressive reaction, feeling sadness, self-deprecation. And then the last one would be psychologic disorder or psychochromatic illness. They could be very minor or very severe. Some symptoms would be like headaches, ulcers, amnesia, paralysis. And then the last type of functional disorder I will be talking about is personal disorder. This is general category for all sorts of mental disorders that the psychiatrist cannot diagnose as either psychotic or neurotic. They have also been called character disorders or sociopathic disorders. So those were all under the branch of functioning disorder. And again, the two types of mental disorders always fall into either an organic disorder or a functional disorder. Functional disorder being the most common, with that they have a larger category, and the ones that psychiatrists and psychologists and sociologists focus on. So the next thing I want to talk about is the DSM-5 classification. So what this is, it's basically a classification that totals over 300 mental disorders that can be found in the Diagnostic and Statistical Manual of Mental Disorders, the 5th edition, hence the DSM-5 classification. It was published in 2013 by the APA. And it's basically like a list of all the mental disorders and their symptoms. So people can, so psychiatrists and psychologists can use the DSM-5 classification. So what causes mental disorders? So some social factors, not that cause, but that statistics and people have found that play a big part in mental disorders is social class. Social class is a big social factor in mental disorders. People from the lower classes are more likely than those from the other classes to become mentally ill. This could be having usually more stress in their lives and more traumatic events than those of other classes. Another social factor is gender. Studies on specific types of disorders do indicate gender difference. So basically different types of mental disorders are more likely to be, like, if you're a woman, you're more likely to get depression and anxiety. And if you're a man, you're more likely to be like a sociopath. And so different gender, so based on your gender, you can be more likely to get one mental disorder than another. Excuse me. Another social factor is young age. The elderly are the least likely among all age groups to become mentally ill. Another social factor is a social profile of depressed teens. So in this social profile, there is mild depression, which is the feeling of being slightly sad over some ordinary disappointment, maybe getting a B instead of an A in your class, something like that. And then there's situational depression, which you would be sadder because of the unpleasant experience that you go through. And then there's major depression, which is a mental disorder involving the kind of sadness that is extreme and out of proportion to the event that has triggered it. The fifth social factor of mental disorders is race and ethnicity. Minorities experience more social stresses stemming from discrimination, poverty, and cultural conflict. Another social factor is urban environment. The urban environment produces a lot of mental problems because it generates an abundance of physical and social stresses in the forms of excessive noise, population density, loneliness, and lack of social support. And then the last social factor would be PTSD, or post-traumatic stress disorder. About 20% of military service members on combat tours return home with symptoms of PTSD. Less of half of these stricken veterans actually seek treatment because of the stigma associated with mental disorders. So a global perspective on mental disorder. Mental disorders are generally higher in modern industrial societies such as the US and France than in traditional agricultural societies such as China and Nigeria. A major reason is the culture of individualism and competitiveness in modern societies, where individuals with personal problems often have to fend for themselves, doing without the relatives and friends who are more readily available to offer support in group-oriented traditional societies. The US, being presumably the world's most individualistic and competitive society, has the world's highest incidence of mental disorders. According to a survey, over 26% of Americans suffer from mental disorders, compared to 18% of French, 15% of Dutch, 9% of Chinese, and 5% of Nigerians. Societal responses to mental disorder. So one societal response to mental disorder is the public. One major difficulty in trying to help the mentally ill lies in the public's negative attitudes towards them. The public's negative attitude about the mentally ill can be discerned from popular stereotypical jokes about them. The court, another societal response is the court. Since the public does not appreciate having the mentally ill around, the court can oblige by putting them away in mental institutes or prisons. This can be done by using involuntary commitment proceedings, denying the right to trial, and allowing defense of insanity. The next one is a mental hospital. Mental hospital is a total institution, a place of residence and work where a large number of individuals are cut off from the greater society and lead an enclosed, regimented life. The patient's needs and desires are subordinated to smooth operations of the hospital. Consequently, the hospital staff members tend to treat the patients as if they were objects rather than humans. And then the last form of societal responses to mental disorder is a community mental health center. Such centers exist all over the country. Their objectives is to offer professionals and paraprofessionals help to the emotionally disturbed. Resources such as hospitals, courts, police departments, welfare agencies, schools, churches, employers, co-workers, neighbors, and other concerned citizens are integrated in order to provide support to anyone in times of stress. Patients can receive inpatient and outpatient care in the communities. This is an important option. Individuals already under stress do not have to suffer either the inconvenience of leaving their usual surroundings or the disturbance of being put away in some distant, isolated, large, and dehumanizing institution. Patients are free from the stigma usually attached to incarceration in mental institutions and have better chances of recovery because of the active participation of family members and others who are genuinely concerned and treat them with respect. All right, so now I'm going to be talking about the perspectives of mental disorder. So the psychoanalytic theory attributes mental disorder to emotional conflict and consequently treats the illness by using talk therapy to resolve the conflict. The stress theory is principally aimed at explaining mental disorder as a result of stressful social experiences rather than suggesting how to treat the disorder. So I'm going to be talking in more depth about all of these models, but the last one would be the labeling model, which is neither explanatory nor treatment oriented. It is it's a more radical critique of what psychiatrists think and do about mental disorder. So the first one is the medical model. The mental illness is similar to physical disease in that its causes are biological. It should be treated then in the same way as a physical disease. The next one is a psychosocial model. One version of the psychosocial model is psychoanalytic theory. Another version is social stress. So psychoanalytic theory traces mental disorder to some unresolved psychic or emotional conflict in the patient. The conflict is usually such a painful experience that the patient represses it, pushing it into the unconscious area of the mind, which is usually why they go to psychiatrists or psychologists to try to get it out of them and try to go back to what started the conflict. The next one is social stress theory. These sufferers usually have gone through life crises such as divorce, unemployment, and death of a loved one. Even less serious experiences can be stressful enough to develop mental problems. Now, we'll be talking about the labeling model. The labeling model advocates of the medical or psychosocial model assume that mental illness is real. Otherwise, they would not bother to look for causes and cureness of the illness. So I'm going to be talking about mental illness as a myth, the impact of labeling, insanity as supersanity, and then the criticisms of a labeling model, which all fall under the tree of the labeling model. So mental illness as a myth, whose function is to disguise and thus render more palatable the bitter pill of more conflicts in human relations. In saying that mental illness is a myth, SAS does not imply that the behavior label mental illness does not exist. SAS simply objects to the use of the label because it masks as well as distorts the true nature of behavior by implying that it is similar to physical disease. So the impact of labeling. When labeled, persons are led to develop stabilized chronic mental disorder. The label is the most important factor in turning a person into a chronic mental patient. Insanity as supersanity. R.D. Laing sees insanity as a supersanity and criticizes psychiatrists for seeing their patients' experiences as somehow unreal, invalid, or false. He feels patients are actually oriented to inner spaces and time, while the psychiatrist is oriented to outer space and time. And then the last one is criticisms of a labeling model, which advocates of the medical model having criticized the labeling model by arguing that mental illness is not a myth, but a real behavior that exists everywhere, and that the mental hospitals do not victimize most personnel labeled mentally ill. Thank you.